Two humorous nurses would like to acknowledge the true custodians of the land in which we record our podcast, the Yorta Yorta people.
We pay our respects to elders past and present and extend our respects to all Aboriginal and Torres Strait Islanders listening today. Always was, always will be Aboriginal land. This episode comes with a trigger warning. We discuss sexual assault, domestic violence and human trafficking. Please use your discretion if this episode is for you. There will be links to resources in the show notes. Two humorous nurses with Kelly and Alicia.
A podcast that can handle the trauma dumps.
Welcome to Two Humorous Nurses, where we plan to bring you funny, informal, conversational chat about all things nursing. Today I'm flying solo because Alicia's singing her heart out as Dragon in the Shrek musical, and she was amazing. We saw her last night. But I think this guest that I've got on today, we actually started talking over a year ago and tried to record it then and just didn't happen, but we're here now. So we started chatting on Instagram and she's managed to con me into going to Bali with her at the end of this year. You might recognize her as Off the Clock Nurse on Instagram or TikTok, but Leah is a sharer of funny TikToks and memes, an expert guide on travel nursing in the US, and are passionate about her role as a forensic nurse examiner, sexual assault nurse examiner, and she also provides heaps of informative educational TikToks on the subject. She loves to travel and most recently went swimming with orcas, which really allows me to live vicariously through her because I just sit at home all the time. So I'm really excited about this chat. Welcome, Leah.
Thank you. And look, you don't have to live vicariously through me anymore.
I know, I'm so excited about Bali, but we'll talk about that later or we'll just get stuck here for ages. Generally, we always start here, but tell us about how and why you became a nurse.
Oh, it's really funny. Everybody has that story of well, I just wanted to help people, or they have some personal story. Honestly, when I was a kid, my dad was a doctor and he would take me on rounds with him sometimes. And if there was an emergency, he would sit me at the nurses station. And so for the longest time, I thought nurses just ate candy and played games because that's what the nurses did with me because I was a kid. So little did I know there was going to be so much poop involved,
Yeah.
so many bodily fluids. So I honestly didn't know what I wanted to do. And and it turned out to just be my parents saying, choose something. And I was like, well, I'll be a nurse. And that is the literal story of how I ended up in nursing school. Mm-hmm. And I didn't have this I've always wanted to be a nurse thing. It was just oh, I have to choose something. And honestly, it was, I think, one of the best decisions that I've made in my life. I mean, it's definitely hard work, but for how flexible it is,
yeah.
With their schedule and the different types of nursing and everything like that, it's, I think, one of the better career paths to take.
My story is almost similar to that. My grandfather was a doctor. Do you wish they had have encouraged us to become doctors? I often think, oh, why didn't, because women were nurses in his mind. And I was like, oh, I wish he'd just said, be a doctor or something.
I had originally gone into college thinking I wanted to be a doctor. And then I was like, wait a second. My dad was always at work. I don't want to do that.
Yeah.
To doctors, but I was like, I want more time off. And then I was like, oh, nurses work 3 12-hour shifts a week. I can do that.
Yeah. Very true.
I don't work every day.
No, that's right.
That's not the life for me, working every day.
No. Work smarter, not harder, hey? But so how long have you been a nurse and where, what areas did you start in?
Yeah, so I have been a nurse for 14 years now, and I graduated in 2009. And here in the US, we had a recession in 2009. So it was actually really hard to get a job. I think I applied to 20, 30 different jobs across the US, and I got one offer. And it was for orthopedics and trauma floor nursing at a level 1 trauma center. And it was so hard. Just we were so short staffed. It was definitely not something I wanted to do. I wanted to do labor and delivery or pediatrics. I ended up in adult orthopedics. And so after a year, I went to the operating room because I had a friend that actually went there, and they're like, the patients are asleep and there's no and I went and I shadowed there, and I just transferred internally. And then after a couple of years of OR experience, I started doing travel OR nursing. And that was just because I wanted to move, and I wanted to figure out where I wanted to move to. But then that turned into 7.5 years.
Yeah.
And because like the flexibility and the pay was just awesome. So, but then I got into this idea that I was going to leave nursing and become a travel nurse recruiter and work from home. And then once I actually started doing that, I was like, oh yeah, I'm working 5 days a week. And then sometimes more, because nurses would text you on your days off or call you on your days off, email, things like that. So it's kind of like a 24-hour job. Shout out to recruiters. It's actually a really tough job. But then COVID hit, and all of the jobs here like disappeared. It was just a shit show. Honestly, here, I don't know how it was in Australia, but here is just, it was a mess. And yeah, and so then I ended up going back to nursing and working as still at home, but as a tele triage nurse. And then I thought I would go back to floor nursing for a little in the middle of the pandemic. And I was like, I made it like 3 months on a bone marrow transplant unit. I was like, this is really dumb. Why did I do this? I forgot why I left floor nursing like a very long time ago. So at the time I had already finished doing my my SANE program, my sexual assault nurse examiner program. But I need to find something else. So now I'm working as an admissions discharge nurse. So I'm not technically bedside nursing, but I still have patient contact. And then I also work as a forensic nurse examiner and sexual assault nurse examiner. And they're both very flexible. One of them's part-time, the other one's PRN. So I really get to create my own schedule, essentially.
It's a nice place to get to in your career after years of nursing, to be able to do that, to pick, not that I do that, you know, I'm a Monday to Thursday in a day unit, so I don't do that. But I was an enrolled nurse for 10 years, which is, I don't know what you call it in America, but like we have enrolled nurses and registered nurses, and then you can scale up into more senior roles. And I was an enrolled nurse for 10 years. And then in 2010, I graduated from my registered nursing. And it was the same deal. It's the global financial crisis here. I couldn't get a job, and I had to, I missed out on grad opportunities. And it was a bit of like, not what you know, but who you know situation. And I like managed to get into a grad program in a private hospital because I impressed the, my clinical educator at uni. And she put my name forward, and same deal. I did 6 months on an ortho ward, and then I went to theatre, and I was like, oh, I'm never coming back. Like, I loved theatre. I thought I would hate it. And I loved it. Spent 5 years in there, and then had a baby, which messed everything up because the operating theatre days are too long and the on-call was too much, and went back to floor nursing. And then, yeah, like the rest is history really. But it's interesting when you move away from somewhere like ward nursing to theatre nursing. And I think you either love theatre or you hate it. And my grandfather was an orthopedic surgeon, and so he'd put the fear of God into me about it. And so I was like, oh, I'm going to hate it. So I never did orthopedics. I never touched orthopedic theatre nursing. I did lots of ENT and urology and plastics.
I loved it. Mine was ortho, neuro, spine and trauma. But honestly, as a travel nurse, they will throw you into anything.
Yeah.
And they'd say, what are your specialties? What do you do? And I tell them, like orthopedics, and all of a sudden I'm doing GYN
Yeah.
surgery on the phone, Googling, like, what is that instrument?
Yeah.
And so you definitely learn a lot
Mm.
traveling, but it's definitely not for people who can't go with the flow.
Yeah. And I've never done travel nursing, but I did do a lot of agency nursing where they send you to different hospitals within the city. And I remember just sort of being like, well, nursing is nursing. A patient's a patient. It's just learning the paperwork. And if you've got your basics, you can nurse anywhere and do anything. And I think in the operating theatre, the surgeon said to me when I first started, because I said, how do I know what to do? And he's like, you have to be one step ahead of me. I said, but I don't even know where you're stepping. And he's like, you'll learn. And like he said, it's like knife, fork, spoon. If I ask for a scalpel, I'm going to need some pickups. If I ask for sutures, I'm going to need scissors. And like, that's easy if you know what the surgery is. But I remember one day we'd done a whole heap of scopes in the lower abdomen, and then I had to set up for something. So I just set it up that way. And they're like, I'm not sure where you think. They're like, I can't remember what we were doing, but it was like spleen or something. And I set the theater up completely the wrong way, and everyone just lost it. They were like, nah, other way, Kelly. Like, where do you think it is? And I was like, I don't know. Because like in my head, I was just like, I'd set the whole thing around the wrong way. And they were like, oh my God. And I just, in my head, I couldn't picture in the body where that organ was. And so when we went in, I was like, show me where it is in relation to organs, which is like a really fun way to learn when you're looking at the internal aspect of someone's body. Like nothing looks like the textbook. Yeah.
Definitely whoever's your surgeon, whoever's in your room really makes or breaks the day. Like if you're like, oh, I don't actually know what I'm doing, but you have like a really great scrub tech, or we have scrub techs here. And or surgeon, and they can come in and be like, this is what I need, and like show you how to do it the first time, then the next time you've got it. But I miss the operating room or theater. I miss it so much. And I actually tried to come out to Australia to work as a nurse, and they denied my nursing license. I was so pissed because it took me like 3 months to get all this paperwork together. I don't think they realized how hard that was. I had to get a letter of recommendation from every hospital I had worked at.
Oh my God.
At least 3 months. And I had been a travel nurse for 5 years at the time. The only reason they denied me was because I had, they require 800, that your nursing school had you do 800 clinical hours. My college, my state only required 765 clinical. And so that's what I had. So they denied me. They were like, well, you can pay like $6,000 and do our 3-month bridging program. But I even flew out to Sydney, and I interviewed at a hospital out there, and they were going to sponsor my visa and everything. I was like, you know what? It's fine. I'm just going to go country hopping instead. That's kind of how all of this international travel started, of just like traveling for fun.
Yeah.
So I'm still a little bit bitter.
Yeah.
Australia's Board of Nursing, but it's fine.
It's fine. I just had to pay my board fees. So I was like, which they put up during the pandemic. Thanks very much. Like middle of the pandemic, and they're like, we're going to charge you more to be a nurse. Okay, you do that. None of us like them very much. Let's talk about the sexual assault nurse examiner role and the forensic nurse examiner role. I spoke to, I'm not sure if those roles in their entirety exist in Australia. I know that there are nurse practitioners in EDs that are trained to do those examinations, but I'm not. I've had very limited ED experience, so there could well be those particular roles out there. But I asked a couple of people that work in EDs, and their particular EDs had nurse practitioners who do it. But tell us about about what they are and, you know, why you decided to get into that area.
Yeah. So I actually first, I didn't even know that this position existed. Like, this isn't something that we talk about in nursing school.
No.
And I never worked in the ER. And so it's really not something that I was ever taught, right? And so it wasn't until I became a travel nurse recruiter, which, I feel like everyone's like the path, like, was I meant to be a travel nurse recruiter? Absolutely not. I was terrible. I'm not in sales. Like, I don't know why I ever thought that was a good idea, but I feel like I was meant to do that job just so that I could find out about this position. Because one of the nurses that I traveled, she was a SANE nurse. She was an ER travel nurse, and then she was SANE A certified. And so when I first saw that, I was like, what is that? And I just started looking into it more, and then I talked to her about it. So when I decided to go back to nursing, I just, it was always in the back of my mind. And during COVID, because typically where you get these done at, these forensic exams done, is going to be the emergency room. And so during COVID, people were so scared to go to the hospital because of COVID. And so they would call the nurse line that I was working at, and, we would have to talk them through, like, what should you do? And basically it was, you have to go to the emergency room to have anything done. But I started noticing, like, the only thing I really knew about sexual assault or domestic violence or human trafficking was anything that I knew from Law and Order SVU. I don't know.
Yes.
Wildly inaccurate. I don't know. But yeah, it's very inaccurate. So I actually, the first person I had talked to who had called in that was sexually assaulted and asking what to do, I gave her completely inaccurate information. And so I kind of looked into different programs, and I found a free program in my state, and it was all online because it was COVID. And so I was like, yeah, I can do that. And I, it was free. So it wasn't like I was going to lose anything. Right. And by the time I finished, it was a 64-hour online didactic. And then I had to go do an in-person clinical for 2 days. But it was just really, really interesting. All of these things that I had no idea. And we're here working at the nurse line, telling people all of this inaccurate information. So I totally forgot what the question was that you asked me. But
why don't you explain, like, what the role does?
Sure. So basically what we do, you can find a forensic nurse or an F&E or SANE. That's what short. We're either in emergency rooms most often, or advocacy centers, or sometimes STD clinics, things like that, places like that. And so if somebody has been sexually assaulted, every place is different. They have to be within a certain day range if they want evidence collected, right? So what our job is we talk with patients, we let them know their reporting options, because in the US, you don't have to talk to the police in order to have a forensic kit done. Some people are just not ready to talk to police or come forward, but there's a short window of time that you can collect evidence, because that starts to wash away after time. Right? So in some places, I think the average for adults, it's going to be up to 5 days post-assault that you can collect evidence. My hospital actually will go up to 7 days. And then for pediatrics, so anyone who's like prepubescent, it's 3 days post-assault. So we also will work with patients who have been affected by domestic violence, specifically strangulation. So we'll do the swab around the neck for like skin cells, and then also take photos. So any, you know, in like the TV shows or movies where you get a photo of bruises with the ruler, that's what we do. We measure out the bruising, the abrasions, and then we document all of that. We offer prophylactic medications. So the main ones are like a Plan B for emergency contraception. We also do cover the 3 main STDs. Obviously, there's way more than that out there.
Yeah.
But we cover trichomonas, chlamydia, and gonorrhea prophylactically. Because if it would be too soon to test for an STD, statistically, they don't pop up for like 2 to 3 weeks.
Yeah.
So we just prophylactically will treat that and then have them follow up at our clinic. And then we will also cover, give NPEP for HIV prevention. And then after that, we give trauma resources because we know that the trauma isn't going to stop just because they've come in and had this kit done. So we kind of give them an idea of what to expect. But I think most importantly, we start by believing. So that's, you know, something that I think everybody should go by, because we're not their judge or jury, right? So basically, we're a person in this entire system. Sometimes we'll be the only people to say, I believe you, and I'm so sorry that that person did this to you. Because at least in our country, in the US, we're not very kind to people who come forward after an assault. Unless you have full-on visible injury, if it was like recorded or there were multiple witnesses, right? It's always, we'll prove it, right?
Yeah, victim blaming.
Victim blaming.
Yeah.
So that is what we do.
I put a little question box in our Instagram stories the other day, and someone asked, like, what is the best and the worst part of this job? And I wasn't going to ask it because I was like, oh, that's a bit like, is there a best part? But I can see that what you do could be very impactful on that victim coming in that moment. So, and I think you've put out lots of TikToks that sort of explain how your role as a SANE and an FE and very well. And I encourage people to go and look at them because you do such a good job with that. But talk me through what you think are the best and worst parts of this job, because every job has its pros and cons, but this is a particularly difficult job, I would imagine.
People, I think, assume that it's really tough having to hear all of these traumatic things that have been done to people. But I think in healthcare, we hear traumatic things all the time.
Yeah, that's so true.
It's not, for me personally, it is not always hearing these really awful things, right? It's, in fact, that's, you know, one of my favorite parts of this job is when I first go in and seeing someone just like they look like they have the weight of the world on their shoulders. And by the time I finish talking with them and doing this exam, they look a lot lighter. And I'll even ask, like, how do you feel right now? And they're like, I feel a lot better, you know, because I got the chance to talk to someone who is not going to interrupt them, I'm not interrogating them. I ask them to tell me what happened, anything they can remember, and I let them know that it's a safe place, that they can tell me anything, and I have zero judgments towards them. You know, like I don't care what they were wearing or if they had how much to drink or if they even were snorting cocaine off a toilet seat. It doesn't like exactly. It doesn't matter what someone was wearing or what you were doing.
Yeah.
There's no excuse for assaulting somebody. Yeah. There just isn't. So that I think that's really not the hard part for me. That's one of my favorite parts, is knowing that someone needs to, like, they want to tell people what happened, right? That's why they're coming in.
Yeah.
Is they get this off of their shoulders, and have someone not judging them. And so I get to be that person. Now, the hardest part is just the entire system in general. And it's not just like there's our judicial system, our police system, our hospital system, right? And there's so many people. The hardest part is getting over people's biases, right? And judgments. And so sometimes I'll even go back out and I'll have another employee that's there and they'll say, so do you think they were lying? Do you think they're telling the truth? And I'm like, well, it doesn't matter either way. No. My opinion on that means nothing, just as your opinion on that means nothing. Like, we're just here to do this job, and you should just treat them with respect like you would anybody else. Like, I think that's like my biggest pet peeve is whenever someone asks me, so we're like, I literally want to say, shut the fuck up.
Yeah.
So I can't. But I think that's one of the hardest parts. Or, just our police system. One of the first questions I'll ask the patients, especially if they have reported to police, has everybody been respectful to you? Because there's a lot of times that they aren't. And that needs to change, because that's going to keep people from coming forward or even going forward with the reporting. So, and really our main goal as the healthcare providers, right, the FNE and SANE, is to make sure that they're coming in at least to get that medical treatment, right? Because if somebody's strangled, they have a chance of having internal injury. They have a chance of having prolonged or delayed injury, right? So tissue swelling can be delayed up to 36 hours in the neck. You can have a stroke up to 6 months after a strangulation. And so we just want to make sure that people are getting the medical treatment, and we want them to feel comfortable coming in and know that they're not that it is a safe and open place to be. And people who have extra training to be able to to provide that. So and even with our judicial system, I think it's only about a 2% conviction rate for sexual assault.
Insane, isn't it? There's my husband just showed me an article yesterday in Australia of a person that had been arrested for assaulting someone, like assaulting minors 30 years ago. He admitted to it, but he's not being charged. I'm like, he literally has admitted to it, but they're like, I'm like, wow.
Yeah. Well, our system doesn't quite understand the difference between domestic violence abusers and anger management. And so when we talk about domestic violence or like intimate partner violence or sexual assault, people think it's anger management and it's all about sex. But with both of them, it's actually all about power and control.
Yeah. And I think a lot of the time, the people that are doing the investigating of these things, the police, and I'm generalizing big time here, I mean, they're the ones that are often carrying out a lot of this domestic violence and power play situations in the home as well. So it's hard to change a narrative when you're in that position of power anyway. Like,
yeah. And I've gotten some backlash from people not understanding what I'm trying to say when I say not all police are abusers, but a lot of abusers are police officers, because they thrive on that power and control. And what is a better position to have power and control than be a police officer? And that's why we see so many people who are abusers in high profile positions as well, like in our politics, right? I mean, look at U.S. politics. how many people who are on our Supreme Court right now that have been accused of sexual assault. Our past president, right, Trump, has just got found liable for sexual assault. And, you know, and they still praise them.
Yeah.
Right?
Yeah.
They're so praised. It's wild to me.
There's been a quite a high profile case in Australia of a politician who has been on trial just recently for assaulting a staffer, and it's they keep in the media, they keep identifying it as like the Britney trial, but it's not her trial, it's his trial. Like, she's the victim, and like, unfortunately, because of social media and the media, the trial, like, nothing's happened to him because it was a trial by social media. So there was too much info out there and they just couldn't trial it fairly. And I was like, it's so frustrating, I think, because this stops people coming forward to even come to the hospital because they're like, well, no one's going to believe me. Or, you know, I listen to lots of podcasts that talk to, I just recently listened to one, it's an Aussie one called The Deep, and Zoe Marshall interviews these amazing people from all different walks of life. And recently she just has been talking to a mother of a whose partner or husband abused their child for like years and years and years. And it was, you know, she walked in on it. And from that moment, this mum said, what I did in that moment, I knew would change my daughter's life. And, you know, like, it's not hard to believe someone when you witness it, but, you know, what she did, like, to get her out of the house, to make her safe. And I think these people just, and the daughter didn't want to do anything because she'd been so groomed by her father, that your role is so important. It being that first point of call in a healthcare system. And I know you've put up, again, TikToks and stuff about how you've intervened with the police and making sure they do have respectful communication with these people. And I think that's so important, to be an advocate. Like, we advocate for our patients all the time, and this is no different. It's just a lot harder because you're dealing with police.
Are you getting sweaty armpits or sweaty balls walking to work in your scrubs? Well, every nurse needs a pair of scrubs that are breathable, super comfy, and not clingy.
Elite Care was designed by a nurse for nurses. They're 55% cotton blend, so they're cool and comfortable, durable, and have plenty of pockets. And when I say plenty, I mean like plenty. Pen loops, chest loops, everything for like your glasses, your name tags, and they have heaps of different designs. They're size inclusive up to a 5XL and have great colours.
E-Nurse have a 100% satisfaction guarantee, free shipping on orders over $150, and are packed within 48 hours of ordering. And they literally have everything you could ever need to do your job.
Head to www.enurse.com.au to check out their whole range of Elite Care scrubs. Don't forget our code Humorous Nurses for a cheeky discount.
E-Nurse loves our nurses. In Australia, we're quite a small country, but we have a very sparse scattering of hospitals across Australia. Like, the little hospital I work in has a nurse-led urgent care centre for like quite a large area, and we have had examples of people come in who have been assaulted, and we have no specific training for that. So what's like one important thing, other than like believe them, because obviously, well, I shouldn't say obviously, but I mean, I would always believe them, but not everyone, as you say, does that. But what's like one thing or two things that these staff who aren't specifically trained can do when someone presents? Because there are lots of nurse-led emergencies or urgent care centres in Australia because of our, very broad population.
Yeah, I don't know what your laws are, right, with reporting and evidence collection. So like here, in my state, right, and so in the US it's like different per state. We actually, in my state, have 3 reporting options. So it depends. Do they want to talk to police or do they not want to talk to police? So if you have someone that's coming in and they want to talk to police and they want to file a police report, I would definitely reach out. And if, it doesn't matter if they're intoxicated, some of them will be like, well, they're drunk, or they are having a mental health crisis, or anything like that, to say like it probably didn't happen because of A, B, or C, right? But that's not for them to decide. Like that's the whole reason of an investigation, right? Yep. So part of that investigation is evidence collection. And so do they have a kit available? And inside that kit, the forensic kit, are swabs. And so that's what we do. We'll swab certain areas. So basically they'll tell me what happened, and from what they can remember is where I'm gonna try and collect evidence. So if they say, and this is a big trigger warning right here, if someone says, well, I remember they put their mouth on my neck. Okay, well, I'm gonna swab the neck and try and look for saliva. Well, they ejaculated inside of me. Okay, so I mean, either way, I'm gonna go ahead and do a speculum exam and swab internally, and I'm also gonna do external vaginal swab. Well, he grabbed, my thigh and he squeezed it really hard. So I'm gonna swab that thigh and look for skin cells, right? Skin, saliva, semen is what we're looking at. Or anything. One time I found like a drop of blood on somebody's, the guy had like cut himself on something. And so, swab that, right? So I think just doing an exam, if they don't want to talk to police, depending on what your laws are there, if they don't want evidence collected and they're just specifically there to get medical treatment, doing the prophylactic medications, having resources available so that they can have that post-trauma follow-up. Like, are there advocacy groups? Do they have a safe place to go? Was this an intimate partner that assaulted them, or are they scared to go home? Do they have a safe place to go? Do you guys have safe houses? Do they have someone to stay with? Do they have a support system? And then also doing, either way, if they want evidence collected or not, it's still good to go ahead and do like an internal exam. I can't tell you how many condoms I have found internally that were left internally. And if that gets left there for how long, then get an infection or become septic. And, so we just really want to make sure that we're covering them medically. But it really depends going forward from there. Whether you take photos or swab evidence, it really depends on the policy, the protocol, and what your laws are there. And so I think that's really important for any hospital to have, because it's when it does happen, whether it's frequently or infrequently, when it does happen, it's really important for that person and the community.
Yeah. I'm pretty sure we have guidelines to follow, but as far as kits and things like that, I'm not sure what we do. It's a good thing to, I think, if you work in a smaller urgent care or something, to have a look at, because I remember when I had my first motor vehicle accident person come in, and like the night shift nurse came on after me and she's like, did you collect bloods from the driver? I was like, no, like I didn't know I had to. And she's like, no, you have to collect bloods. And I was like, okay. Like, I was like, I had no idea. Like, it was just, and it was so obvious afterwards. And she was like, oh no, you need to look here. Like, there's this, protocol here. And I was like, oh, I did not even know that. Like, I was literally just treating their medical, and like, not even the doctor said anything when I rang him. But anyway, these things happen. Let's do a bit of a shift, because you've given heaps of information, and I really do encourage people to go and check your page out. because you're and I say TikToks, but it's not TikTok as in like silly things. They're like really informative. And you even put one out today, which was really informative about why people, once they start the healing process, just don't get over it. Like, it's so just trauma in general, not necessarily even from sexual assault. I think it's relatable. But speaking of TikTok, like your social media presence, I mean, that's how I found you, just scrolling on Instagram. I find a lot of people just doom scrolling on Instagram. You have how many? You've got about over 24,000 followers on Instagram. What got you into social media? Like, how did you find the transition into that space?
I feel like I was one of the OG travel nurse influencers on Instagram when that was just starting to be a thing. And so I was just traveling. I would do my 13-week contracts and then take a month off and go country hopping. And I just would start sharing stuff on there because so many people, mainly my friends, would just say, I'm going to go to that country. What did you do when you were there? Or where did you stay, or things like that. So I just started kind of writing, like documenting it. And then from there, it just kind of grew. And now it's taken a shift from travel nursing, which I do still talk about, but I feel like there's just such a lack of information on sexual assault and domestic violence and human trafficking, that I really wanted to kind of shift it towards that information. So it's definitely not for everybody, but it is for everybody.
Yeah.
Some people might choose not to listen to it because it's not really a super bubble, happy topic, but is something really important.
Yeah, definitely.
Because every single person, whether you know it or not, knows somebody who has experienced sexual assault or domestic violence.
Yeah. Yeah, which is really sad, to be honest. I think I'm not very good at social media, so I'm super glad that I lived my life pre-social media. And so I was well and truly an adult by the time, like my 10-year-old's out there. That's what she came to say when we first started. She came to the door and she said, "I found a filter that changes my eye colors." I'm like, oh my God. like she's all over TikTok. She doesn't post anything. She makes them, but she, we're very safe. We have lots of discussions around social media and safety and kids. And because obviously it's a horrific place for children. It's hard enough for us. Thankfully, my platform with Two Humorous Nurses is pretty chill. Like, it's pretty nice. We don't get very many negative comments or anything like that. How do you handle the pressure of social media? Because I'm sure you get a fair bit of lashback given your content that you put out there.
Before, I used to try and change people's minds, and then I realized that's not going to happen through social media. Most often they're just like keyboard warriors, right? Yeah. So now if someone sends something nasty to me, I literally will just block it. Because I don't have the time or energy to focus on them, and you really are not going to change their minds.
No. And I feel like those people that comment, like, it's just such a waste of your energy and your space, because sometimes those one negative comments are enough to like drown out the 15 really good comments that you've gotten. And I really do feel like it takes a lot to be, I don't know, stable on social media. Like with mental health, we don't try and put too much out there, especially politically or anything like that on our platform, because firstly, I don't think we know enough about it, and it's not really our place to do that. But what we try and share is fun and upbeat. And, like this podcast is just to look at the lighter side of nursing rather than educational or anything like that. And I feel like you have a really good way of mixing both the light plus the heavy, and you do it in a way that's easy to watch and listen to and is educational and accurate. Like, I think there's a lot of people out there putting inaccurate messages and stuff because there's no policing anything.
Right. And I think it is, for my topic, it is important to talk about political things because especially here, what's going on in the US right now with all these anti-abortion laws and even child labor laws are becoming more relaxed, and attack on our trans youth and LGBTQ plus communities. It's just, I don't know, there's just so much hate in this world especially in our country, and with these mass shootings that happen and nothing ever changes because we're so divided. And I don't know, I think what people don't realize, okay, so I live in a pretty liberal state, and for us, whenever there's a president that gets elected, and if they're a Republican versus Democrat, so if a Republican president gets into office, they immediately sign this bill that makes any federally funded hospital, healthcare worker, which is where I work, we are not allowed to talk about abortion access. So we can't talk about it. We can't provide services. We can't offer any of that. But when the Democrat president gets in, they sign it through. It's so weird because we're like, are we allowed to talk about it now? Then you can get in trouble, right? It's the law. Yeah. So, and right now, and there's they keep saying, well, there's no exceptions for sexual assault, pregnancy with sexual assault. Or some places they do say that there's, like, I think in Utah, maybe there's a sexual assault, what is it? Like exemption, for abortion. But I'm like, okay, so how do you go about doing that? Well, it takes away their option of not reporting. First off, they have to now mandate if they want to get an abortion that they were sexually assaulted, and then what? Like, how do you prove? How do you prove they're the other? It's just, I don't know. So I do talk about politics. Whenever I do talk about politics on my page, I see this mass accident.
Yeah.
But you know what? It's like, whatever, because it's important. It really is. And I don't think people realize here just how much it does affect a huge majority of people. It's just, they just don't care until it happens to them.
Yeah, that's exactly right. And that's what, my husband gets so mad at me because I'm not politically minded at all. And he's like, but it affects you. And I'm like, well, not really. And he's like, but it does. And I'm like, yeah, I guess indirectly. But I mean, in Australia, we certainly don't have anyone policing it. Well, not yet. I suppose, anything can happen, can't it? But no one's policing our bodily, like, rights to things. Like, our healthcare system is pretty, on the whole, pretty good. Like, there's no one telling us we can't do things. That can change, obviously. You have two other aspects of your social media, which I love, and that's Dakota, your dog, who plays the management role on almost a lot of your TikToks, which every time you involve her, it makes me laugh so much. And your houseplants, which you've just started to make a feature, which I really enjoy because I have like a black thumb. So I kill cactuses. Like, that's how bad I have fake plants, so
I have so many plants. A couple years ago, I had a fungus gnat issue and I
oh,
changed the soil and then I quarantined them in my bedroom. And then I started with this not chronic cough, but this cough that lasted like 3 months. And I went to the doctor and it turns out I gave myself a fungus infection in my
oh,
lung.
from your
So
plants.
I had like 30 plants in my tiny ass room with the door closed. It's like wet soil with the fan going. I gave myself a fungus infection in my lungs. So don't do that.
Yeah.
It's fine, a lot of plants, but you need to space them out apparently, and have good filtration. So I have a couple of air purifiers in my apartment now. But yes, my plants. You know how they say like when you're sexually frustrated, you chew ice. Like a thing. Well, my thing is I buy plants, and so this is like how frustrated I am. I have just like in my place.
When you go away on your holidays, do you have to pay someone to water your plants and look after your dog?
Yes.
Is that yeah?
I'm lucky. I have a great neighbor across the way, and she will come over and
Oh,
she
that's
takes my
nice.
watch it, comes over and waters my plants, and she is also really into plants. So
Oh, that's a
between the two,
bonus. Yeah.
we trade off on watering each other's plants.
That's good. Now, traveling obviously is a big part of your story, and we're going to Bali in September. You're hosting a trip full of nurses, and I'm a little bit scared because, and I laugh when I say to people, I'm going to Bali with a bunch of American nurses, and the running joke in Australia is that Americans are the worst people to travel with.
So bad. We're so
Yeah,
bad. No,
and
I think it's a good group. I think like the group chat that we have going, I think they're pretty good. So we'll see. This is definitely the first time I've traveled with people that I don't know. I usually travel by myself or I'll go with a friend. And I'm typically more laid back. And so, because I like this is going to be so different for me because I usually sleep in like the dumpiest places
yeah.
because it's or like I'll just like go hop on the back of a strange person's moped to get around and then just like,
Yeah.
throw them a few and but this is all like planned out and with a group of people that I haven't met. I've just met through social media. So I think it'll be a good time though. I don't know. Are you gonna get a tattoo?
Well, I made a promise to myself at the start of this year that I would get no tattoos this year. So I don't know. So the funny thing with Bali is Bali's like Australia's little playground because we can just go there so cheaply and so quickly. And I'm from Western Australia, and a lot of people in Western Australia go to Bali all the time because it's only a couple of hours and it's like super easy to get to. And I was listening on the radio the other day and they were talking about how Bali are going to put out a travel card to Australians when you come with like do's and don'ts, because we go over there and we get really drunk and rowdy and and just they're like, this is what you shouldn't do when you come here anymore, people. And I've never been to Bali. Like, it's my friends and I tried to plan a group trip a few years ago. Or I say a few years ago. This was like maybe 20 years ago. God, I'm old. And we never made it. So I'm like very excited. I also never travel with people I don't know. I've never traveled in a group this big. I've never been on a guided trip. I love being alone. So I know there was talk about like, let's go to the swings. I'm like, I'll stay at the pool. Like, I'll wave you off and welcome you back with a drink. I'm like, but I'm excited to like, I think when you put nurses together, like we all have something in common, and I think in that group chat, everyone does something different. So
it's trauma. That's
trauma bond. That's it. Yeah.
We'll just be trauma dumping this entire trip.
Yeah, exactly.
Laughing. No, I think it'll be a good time. There's people of all ages, and I was a little worried at first when people were signing up. It was like all was it like 35 to 48 women, you know, age range, and then all female, and then one, what is it, 29-year-old guy.
Oh, oops.
Like, oh, I was like, hey, you know, we all have lower back pain, and we're probably gonna be asleep by 9, but now there's like a few younger people coming, and I think it'll be like branch off. Like there'll be some people that go out partying, and then there'll be like you and me that were like in our pajamas.
Yeah, I'm like, if we start drinking at lunchtime, then like we can have dinner and go to bed. Yeah, like I'm really excited. I am very nervous, but I'm also just like, how bad can it be? Like, it's not. I did pay extra to have my own room, though. I'm not that adventurous to share with a stranger.
I would too. I think any group, I have gone on a couple of group trips before, and I paid for my own room, and it was totally worth it.
Yeah.
Just because, it was just, you need your alone time.
Yeah. Yeah. I see the Selfie Girls just did Bali recently too. I haven't listened to their episode on it yet, but I'm definitely going to listen to their episode before we went. But their trip was a little bit more active, I think, than yours.
Because I was like, there's no way I'm hiking up. Like I am such a couch potato. Like I just want to eat and relax. And when I did the survey, there's a survey that went out, and it said like, what are you most interested in? And most people, I got like maybe 300 entries, and most people chose relax and eat. And I'm like, these are my people. These are the people that follow me. They know me. They understand me. I have found my people. Let us go, relax and eat. And I'm down for that. So
and I love that we're going to like a coffee place to learn how to make coffee. I'm like, yes, we will be doing that.
So no one's we're not hiking any volcanoes or anything, but are having a cooking class. So
yeah, that's exciting. And that's what I would want to do if I was going to Bali. I was like, go and to the rice paddies and cook a like Asian meal. It's like perfect. Thank you for chatting with me today. It's been so nice to get to know you a little bit more and meet you before we actually meet you in September. I am going to bring like my microphone and stuff on the trip so we can have like a drunken
yes, that'd be so fun.
We can do like a debrief or something. Like we could be like in the pool and just be like, yeah, this will be good.
I would love that. Oh my gosh, that's gonna be an incredible time. And there's a lot of people, from the group chat that have a lot of like exciting and funny personalities. So
yeah.
Have everyone jump in.
It's gonna be so fun. Where can people find you on social media? Plug your stuff.
I am on TikTok and Instagram as Off the Clock Nurse, and I am on Facebook as Off the Clock Nurse Travels.
I will link everything as I usually do in the show notes. You can find us at Two Humorous Nurses Podcast. Leave a 5-star review on the podcast platform that you're listening on, because your reviews help us be found by others. If you've got any funny stories or you just want to send us something to chat about, you can email us to hello@twohumousnurses.com. That's humorous like the bone. HUMERUS. You got to help me say goodbye, Leah. You ready? Bye.
Bye.
Bye.